Aloha, I'm here at the Dr. James T. Kakuda Cancer Center. They are celebrating their 5-year anniversary. So let's talk to some medical professionals who have been here since they opened in 2017. So I am with Dr. Ian Okazaki, and I just wanted to ask you, can you tell us about the Dr. James T. Kakuda Cancer Center and what services that are offered here that makes it unique?
The James Kakuda Cancer Center was designed to be a multidisciplinary cancer center, and what that means is that you're bringing together all the team members that are required to deliver cancer care. And the nice part about a cancer center such as this, and for oncology care in today's environment, is to have folks that touch every single facet of oncology care, from the beginning when there's suspicion of cancer, and then diagnosis, and then into the treatment phase, and then coming out of treatment. There are folks that are touching the patient and family throughout that entire, we call it a continuum. Mm-hmm. And what the Cancer Center does is it attracts people to come and work collaboratively in the cancer world. And so this means that the folks that are doing the surgery in the hospital, the pathologists that make the diagnosis, and the nurse navigators that at the time of diagnosis can contact the patient and family, let them know that we have the diagnosis and there are specific things that we are going to embark on right away. So that way you get into the diagnosis and treatment portion of cancer care right away. It eliminates a lot of the anxiety, which is what used to be the case when before this collaborative care model was available. People would have a diagnosis and they'd wait forever before they get the diagnosis, and then once they get the diagnosis, then it's a 1,000-pound weight on their shoulders. What we do here at the center is secure the diagnosis, communicate quickly with the patient and family, and let them know that these are the pathway forward requires meeting and getting to know all kinds of team members that are going to help you through the process.
Going off of that, cancer care just requires multiple professionals. So what do you think you and your team has been doing for these patients? I mean, on a personal note, with having multiple professionals taking care of each patient.
So one of the most important steps was to have particularly the oncology providers focus on cancer types. So we have a breast cancer team and a lung cancer team and a gastrointestinal cancer team, etc. So that there's specialization for the different cancer types, and that provides expertise, and it's more refined and a little bit more focused than in the old days when we used to see all kinds of cancers. And so having that focus then provides expertise, but also comforts the family knowing that there's some special care going on. But the nurses and the nurse navigators and the other team members are also focused. So everything is really tailored to each individual patient and their special case.
So I'm standing next to Noy McGuire, who is an RN here at the Cancer Center, and she's actually a nurse navigator. So I just want to ask you, what exactly does a nurse navigator do?
That's a great question. A lot of people ask me what nurse navigator does. So I'm specifically an oncology nurse navigator, which basically means that once a patient is diagnosed with cancer, we'll connect with them. And as you know, navigating your way through the medical system is crazy, but add cancer to it and most people are like, oh my goodness, what's next? So as a navigator, we connect with the patient, we ensure they understand their diagnosis, and then we make the appropriate steps that they need to get to where they need. So whether it be a surgeon, an oncologist, support, whatever the case may be, that's we're here for them.
So from your personal experience, what do you think these patients can benefit from having a nurse navigator compared to walking into a normal clinic and seeing a normal nurse?
So being that we're usually the second, because once they get their diagnosis from their physician, we're the ones who connect with them, and having that initial connection, assessing them emotionally, physically, socially, etc. You know, it's
building that
bond, you know, and being there from beginning throughout, through surgery, through treatment, and beyond. You know, we build these relationships, and knowing that they have someone who's on their team from beginning, you know, throughout
the whole process.
Yes,
well,
yes.
that's very special.
It is. It's amazing. It's these families and these people are so strong. It gives me strength, and it gives me such aloha, you know, to be able to be that little ray of sunshine in their darkness.
So here we have Dr. Dr Killeen, and I just want to ask you, what are some of the partnerships, collaborations, and certifications that these patients have from the Cancer Center?
Sure. I'll start with the certifications, because the cancer program, both here at Polimomi and as in the HPH system-wide, is accredited by the College, American College of Surgeons Commission on Cancer. And we're actually very proud that this year we will become the first institution or set of institutions in Hawaii to be accredited as a network, meaning that all of our facilities are under one program. And what that does is it lays out very specific guidelines and requirements for a cancer program that is managed in a multidisciplinary fashion. And I always tell our team that that's the floor, which is very difficult to attain, but that's the floor. We then go up, because there is certainly more we can do. Part of being able to get to that point means we have to collaborate, because there are parts of that requirement that have to do with, for example, research. So we're a partner with the University of Hawaii Cancer Center in delivering many of our clinical trials for patients. Part of that requirement has to do with a relationship with radiation oncology, and so we collaborate with the Cancer Center of Hawaii, which is at Polimomi an on-site collaboration with the radiation oncology professionals. So making that multidisciplinary approach, which is the core value we have, is multidisciplinary care and subspecialty cancer care, meaning that not all cancer patients are treated the same. Breast cancer patients are treated as breast cancer patients. Lung cancer patients are treated as lung cancer patients by people that are dedicated to that tumor type. That's what we mean by subspecialty care. There's a lot of data showing that that gives you better outcomes, and so that's the system and the program that we've tried to adopt.
I like that. So when you say it starts from the base, which is the certifications, which leads to the collaborations and the partnerships to bring it all into one. And can you touch on the name of the Cancer Center, Dr. Kakuda? Can you tell us why it's actually named after him and what impact he has on the Cancer Center?
A huge impact, and I'll just really briefly, I was involved in the recruitment of Dr. Kakuda back in about 2000, over 20 years ago. And he was recruited because we wanted to add to our early team of oncology specialists, in particular surgical oncology specialists, that understood this multidisciplinary subspecialty concept. He was trained in it, and he was a huge advocate of it. So we brought him on board. He soon ended up on this campus, and he started to build that on this campus. And it takes time, because it's a very different way of thinking and practicing than many clinicians were originally trained in. But he kept at it, developed those connections, the collaborations for this campus, and that culminated in this center being built when he was here. And the whole idea of this center is not just that it's a beautiful building, it's comfortable, that's all true. It's the kind of care that takes place here, which is multidisciplinary, subspecialty care in an environment that's patient-centered. So that was James's vision. It was the vision of our program. He unexpectedly passed away in 2018, which is a huge blow to our program and to this campus. And we're still recovering in some ways, but we all know his vision, and we're going to make sure it keeps going. And so that's how his name got on this center.